Welcome to Smile Nursing tutorial. Today we are going to discuss about the Iucd. What does it mean? Postpartum intrauterine contraceptive device, which is very important. Okay. First, what is postpartum period? That means first 6 weeks after the birth of child, as by then the woman's body has largely returned to its pre-pregnancy state. Now we have discussed about the postpartum period. Again, in this postpartum, we have three types. One is immediate postpartum, second is early postpartum, third is extended postpartum. Now we are going to see the immediate postpartum. That means post-placental and within 48 hours after delivery. It is ideal to educate the woman on exclusive breastfeeding as a contraceptive method. Iucd sterilization should also be provided in this period. After that, we are going to discuss about the early postpartum. It is up to 7 days. Sterilization also can be performed. Third, extended postpartum. That means 6 weeks to 1 year. Intrauterine contraceptive devices have been used by women in India. The Ucd 380A is used to immediate postpartum insertion as a method of contraception. Iucd can be placed immediately following delivery of the placenta and during the cesarean section or within 48 hours following childbirth. The woman must be counseled advantages, effectiveness, side effects and problems related to the Iucd. Next, coming to the timing of Ucd insertion. We have to know about at what time we should insert the Iucd. Immediate postpartum, in that post-placental insertion within 10 minutes after expulsion of the placenta. Second is intra-caesarean. That means insertion during the caesarean delivery after removal of the placenta and before closure of the uterine incision. Third, within 48 hours after delivery. Fourth, post-abortion. Insertion following an abortion if there is no infection, bleeding or any other contraindications. Fifth one is extended postpartum or interval. That should be inserted any time after 6 weeks postpartum. The main important thing is the Iucd should not be inserted from 48 hours to 6 weeks following delivery because there is an increased risk of infection and expulsion. There are two types of Iucds available in our India. One is copper bearing Iucds and progesterone releasing Iucds. Copper bearing Iucds, the CUT 380A is available in the government sector. It is highly effective, more than 99%, and can be used for 10 years and can continuous use. Coming to the advantages of the Iucd. There are many advantages. Convenience and saving the time, and it is very safe. It has no risk of uterine perforation, reduced initial side effects of bleeding and cramping. We have to give written post-insertion instruction to the woman, record information in the client's chart. The woman consent the Iucd removed anytime she desires for a pregnancy. Today we have discussed about the postpartum period and types of postpartum and timing of Iucd insertion, types of Iucds and advantages of the Iucds. Thank you for watching this video. If you like, share, subscribe and comments.